So what is fatigue? Other descriptions of fatigue by people with MS. Fatigue is like being weighed down as if you're trying to walk up to your neck in a deep muddy river in heavy wet clothes carrying shopping bags full of rocks.
My hands and legs feel like lead weights.
It's all encompassing, mind and body.
It's not like the buzz you get from tiredness after exercising. There is no buzz from fatigue.
Fatigue symptoms may be experienced as overwhelming tiredness, visual disturbances, difficulties with concentration, memory problems, muscle spasms, mobility problems. In fact, any of the symptoms that you get from your MS will be made worse because of your fatigue.
All sorts of things contribute to making you tired. These can be social factors such as stress or the type of lifestyle you have, or physical factors like your MS symptoms, for example, an infection or anemia. Emotional factors can be things like anxiety, depression, or perfectionism. When someone is fatigued, they will either reduce their activity and rest, or they will have bursts of excessive activity in the hope of getting better. People who rest for long periods of time find that when they start doing activities, they will tire more easily and have increased pain and/or fatigue. Similarly, fatigue and pain will also follow periods of excessive activity. Frustration can ensue, leading to people feeling miserable and demoralised.
There are two basic types of fatigue. Primary fatigue, which is unique to MS and the disease process, and secondary fatigue. There are many factors which can cause fatigue which are not unique to MS, and it's important to identify whether fatigue is due in part to one or more of these. This can be invaluable in the management of fatigue, as these can then be avoided or treated directly. Primary fatigue is experienced as a direct result of damage to the nerves or inflammation to the myelin in the central nervous system. Short-circuiting or nerve fibre fatigue is where performance deteriorates during sustained activity but improves again after a short rest. For example, you may find that your foot starts to drag after about 10 minutes of walking, but after rest it's okay again. This is due to a chemical overload. The messages can't get down to tell the muscles to move. It's a bit like a traffic jam. You just have to wait and eventually things will get moving. You cannot push through nerve fibre fatigue. Lassitude, on the other hand, is an overwhelming tiredness which is unrelated to activity or exercise. Heat sensitivity, or Uthoff's phenomenon, is where a small rise in body temperature can interfere with nerve conduction and cause fatigue. This can be due to external temperature, a hot day, a hot room, or your internal body temperature, which may be raised due to an infection, to exercise, or, for example, the menopause. And central fatigue. In people with MS who have fatigue, the time taken for messages to get across the brain is longer and more convoluted. Although we're talking microseconds, it's still enough to cause fatigue. Secondary fatigue. With an infection, your core body temperature rises, which causes fatigue. This is why it's important to get any infection checked out as soon as possible. Sleep disturbance. If you're not sleeping at night, you'll be more tired during the day. We will be discussing sleep later on in the healthy lifestyle section. Environment. It's important to ensure that your surroundings do not make your fatigue worse. Is your workspace, home environment organised for ease of use? Is there adequate lighting? Is the temperature right for you? An occupational therapist can look at these for you. Having to cope with pain can increase your fatigue. Speak to your GP, MS nurse or physiotherapist for advice. Poor mobility and coordination means extra effort, which equals fatigue. A physiotherapist can assess your walking and give you appropriate stretching and strengthening exercises, exercises for balance and coordination, and/or walking aids to make it easier for you. If you're tired, it's hard to motivate yourself to exercise, and this lack of exercise can make you less fit, lead to weaker muscles, and consequently make moving more difficult. We will discuss exercise in more detail in the Healthy Living section. There are strong links between fatigue and depression. Low mood, anxiety and depression may be due to nerve damage or the emotional impact of MS and should be acknowledged and treated appropriately. Many common drugs used to manage multiple sclerosis and related symptoms have side effects which can include fatigue. The dose of any new medication that you receive will be slowly increased to get the best possible effect for the smallest side effect. Most symptoms should settle after a few days. If fatigue persists, it's worth speaking to your GP or your MS nurse. These are some of the medications that can cause fatigue. It is not possible to make fatigue go away completely, but through an awareness of the symptom, consideration of lifestyles, and the use of particular techniques, it is possible to start to manage fatigue and to take the steps to reduce the impact it has on daily life.
Now that you know a little bit more about your fatigue, you need to look more specifically about what is causing your fatigue. In your pack there is a modified fatigue impact scale. Go through this answering how fatigue has affected you over the last 4 weeks. If you have had a particularly good or bad month, do it over a normal month. Then score yourself using the scale. This will show you whether fatigue affects you cognitively, for example, thinking or memory, etc., or physically, which is more in your movement or both. Also, psychosocial relates to getting out and about. Now you have looked at your fatigue, we need to look at how to manage it. Fill out the activity diaries over a few days. By doing this, you will see what you do throughout the day and whether there is a pattern to your fatigue, what is causing it, or when you are most fatigued. Complete these forms over the next week and then come back and continue on to the next section.